Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is optimizing the surgical team's ergonomic and is presented by Dr. Yurteri-Kaplan. Just a few quick notes. This webinar will be recorded and the recording will be available on CITI program's website. This webinar is also for educational purposes only. It is not designed to provide legal advice or legal guidance. You should consult with your organization's attorney if you have questions or concerns about the relevant laws and regulations that may be discussed in this webinar. In addition, the views expressed in this webinar are solely those of the presenter. Now let me tell you about today's presenter, Dr. Yurteri-Kaplan is the Associate Professor, Section Director of Urogynecology at Columbia University Irvine Medical Center. She is fellowship trained and board certified urogynecology and obstetrician gynecologist. Her undergrad was at Cornell University. She attended medical school at Virginia Commonwealth University of Medicine. Her residence was at Rutgers, New Jersey Medical School in Newark, New Jersey, and she has a fellowship at the MedStar Washington Hospital Center and Georgetown University School of Medicine. She also holds a master's in clinical and translational research in Georgetown and Harvard University. And now I'm going to pass the mic to Dr. Yurteri-Kaplan.
The learning objectives for today include the following: identifying work-related musculoskeletal disorders that are common among surgeons, surgical assistants, and the surgical team, evaluating current best practices in use to prevent work-related musculoskeletal disorders, and then propose some future directions for ergonomic intervention, research, and surgical practice. And what we found when doing this systematic review was that there was a predominance of work-related injuries and musculoskeletal disorders in the lower back, the neck, the shoulders, the hands, the wrist. You want the height of the table to be adjusted so that it's kind of at hip level. And you want to bring that chair as close as possible to the table to avoid forward flexion of the trunk. This one I love as well, especially because I find that I often have a lot of strain in both my upper and lower back. So this is a spinal supine twist. In this particular stretch, you lay on your back. You're going to bring your knee to your chest and you're going to do a nice little squeeze. You take your knee and then cross at midline. With the opposite arm, you stretch it out like a T. So you can kind of see in those pictures she's T'd. And education really does make a difference. There is ergonomic curriculum given to robotic gynecologic oncology teams, faculty, residents, and fellows. And ultimately, after that curriculum, it was noted that there was an 88% change in practice, a 74% improvement in pain and discomfort.
And I'd like to remind people to make sure to follow us on LinkedIn, Facebook, and X for news, up-and-coming webinars, and new courses. Subscribe to our YouTube channel for demo snippets and past webinars. Speaking about subscribing, I'd also like to invite you to subscribe to our podcast, On Campus with CITI programs, on tech ethics, and on research. Please also consider subscribing to our weekly newsletter. I invite you to review our content offering regularly as they continually adding in new courses and webinars in various areas of research, ethics, compliance, and professional development throughout the year. In particular, you may be interested in our Safe Research Environment course, as well as other EHS courses such as Laboratory Chemical Safety. And that concludes our webinar. Have a wonderful day.